If you're experiencing lower back pain, neck pain, aches and pains, or injuries from a car accident, you need to see a licensed chiropractor. Don't suffer any longer dealing with pain. Our experienced chiropractic team can help you start feeling better in just a few visits. The best part is, treatment involves no drugs and no surgery. We're committed to bringing you better health and a better way of life by teaching and practicing the true principles of chiropractic wellness care. So contact us now to set up a free consultation. You've got nothing to lose but pain.
Okay, so what's going on?
The injury took place like 2 weeks on Saturday.
2 weeks ago?
2 weeks ago on Saturday. I basically played basketball and then landed awkwardly and then it kind of like popped out.
Did you fall on it or did somebody...
I fall on it.
Fall on it?
Yeah.
With your hand forward or on the side?
On the side.
On the side?
Yeah.
Did it hurt right away?
Yeah, it hurt right away and then was taken to the hospital by my cousins.
Okay, what did they do? Did they do x-rays over there?
Yeah,
or?
they did x-rays.
And what, any fractures or anything? Did they find anything?
Just, I think it was a small fracture.
There's a small fracture?
I think so. I'm not quite sure, but...
Is there a fracture or there is not a fracture? What did they say when they... If you would have a fracture, you would have a cast on it right now, but I guess there is not...
I would say no.
No, yeah,
fracture,
I don't think so. 2 weeks ago. Now, in terms of the pain...
pain, I would say, depends how far I move.
on the scale from 1 to 10, what's the level of pain?
The level of pain right now is 0.
There is no pain?
No pain right now.
Then what's bothering you?
Just my fingertips. Like the tingling, and my ulnar nerve is kind of numb.
Okay.
So
do you feel your pinky finger? Do you feel these two, the last two?
Yeah, I can still feel it, but it's still like
numb
and sensation and tingling sensation.
And in terms of moving your shoulder, can you move it? Does it hurt?
I can move it, but I can't really like move it all
so
the way.
So it's very limited.
Yes.
Okay, what about like this? Same?
Yeah, just...
What about the other one? What's the difference? Do both of them. Do go up?
This is higher.
Okay, what about front? Like this? Okay, how about backwards?
Backwards,
okay, and sideways, so the right one is a lot higher, right?
Yeah, the right one is a lot higher.
Okay.
So, yeah.
Okay, what did you say the level of pain, 1 to 10?
1 to 10 as of right now, if I don't like really move my arms, to see if...
At the end of range of motion, what's the level of pain?
I would say 2 to 3.
Okay. And this numbness really bothers you, right?
Correct.
Okay. Have you ever been to a chiropractor before?
Yes.
Okay. Yeah. So, did they prescribe you any pain medication at the emergency room?
No.
No? So what did they say? Did you shoot x-rays and they say go home?
More like a relaxing kind of medication.
Was Soma? Muscle relaxant?
Yeah.
Okay, so they gave you medications.
During that time, I had my face, so they did an x-ray on my face and I got a fracture on my jaw.
Okay, so they
so the medication is for my mouth.
Oh, so that was antibacterial. It wasn't for the pain.
Correct.
Okay. Yeah. So after you went to a hospital, did they give you any instructions of any kind?
They just say just relax and trying to...
just gonna wait until your shoulder falls off?
Trying to stretch.
Okay.
But the thing is, I don't have like a primary doctor.
Okay. So in terms of the symptoms, since the 2 weeks ago, since the beginning of the injury, have the symptoms been getting progressively worse or not?
No, only my fingertips.
Okay. Let's take a look and see what's going on. Okay. Any pain around here?
Right there.
Right there?
Yep.
How about on the back?
Yes, right there.
Okay. How about your neck? Any pain around your elbow?
Elbow, nope. pain, just numbness and.
Okay. Alright. Does it hurt
Yeah,
right
right
there?
there.
On the front or in the middle?
From
Inside?
the back.
Does
Yeah,
it-
both.
Both?
Uh,
How about if I do like this?
yes.
Yes? Okay. And you say you have no shoulder pain. Is that
Yeah.
0? What is it now? 10?
Yep.
Okay.
10.
Okay, how about backwards?
Yep.
Yes? How about like this?
That's
Not as bad?
not as
So
bad.
mostly when you go backwards, sideways, and rotation.
Yes, correct.
This one is bad too?
Oh yeah.
Yeah? No pain. You're lying.
No. Well, like I said, there's no pain for me to like if I don't move it.
Okay.
But if you start making me move like way
Any
out of
pain
my
around
range,
here?
no.
Okay.
Yeah. Like I said, no pain if I don't like really extend my left shoulder.
Bend forward. Back. Forward again. Okay.
Misalignment or
Yeah, I'm just checking, doing my diagnosis. Stand up.
okay.
Face the wind, march in place. 1, 2, 1, 2. Okay, stop. Okay. So I'm just go ahead and put your hands right here and remove the shoulder of the pelvis. Okay. Just gonna to show the posture. Everything is out. Shoulders are on different level. The ears are on a different level. Okay. Okay. So go ahead, have a seat.
Okay.
So what happened to you? Basically, you fell on your shoulder and you had an internal damage. All the muscles, all the ligaments and tendons that surrounding the shoulder, they had sprain and strain injury. And as a result, you didn't do any rehabilitation. Right now, what happens every time you have a soft tissue that gets injured, so these are healthy fibers, okay? When they get injured, they're trying to heal back, but instead of healing back, they heal back like this and they create these trigger points or knots.
Oh, okay.
And what happens is that if you don't rehab it and they don't break them down, they grow. As they grow, it limits the range of motion even more. And it kind of protects your joint from moving farther. And as a result, every time you try to move, when these grow, they limit range of motion even more. And these knots are very painful. So every time you bring it to the limited range of motion, it creates a lot of pain in any direction. So what we need to do is basically break this up and put them back in place. That will bring the shoulder full range of motion and will relieve the pain. Okay? But this is only half of the problem. The other half of the problem is that your spine, hold this, let me bring the spine. So your pelvis is really out of alignment. So if you look at yourself from behind, you see this line is higher than this one. It's about 2.5 inches difference. So its pelvis is like this.
Wow.
So the rest of the spine is kind of compensating. Makes your left shoulder higher than the right one, than the right one, and then your right ear is higher than the left one. I also made a video so you can see the difference, okay? So you don't think I'm making it up. And then also the left spine of your lumbar spine is not moving. So the first thing that we do, we fix the foundation, which is the spine. Your shoulders are attached here. They're kind of like independent, open kinematic chain. This is like the main, because all the nerves are attached here. So we want to make sure that biomechanically the foundation of the entire body is aligned. So I'm going to adjust your entire spine. And after I adjust your spine, I'm going to work on your shoulder and see how much improvement we have after the first visit. And based on that, I'll be able to tell you how many more sessions you need.
Okay.
The good thing is that you're young. The bad thing is that you waited for 2 weeks. So kind of like it's not beneficial for you. Does it make sense?
Yeah.
And then basically, like I already said, based on an outcome of how much improvement you'll get, I'll be able to recommend how many more sessions you need. Could be 2, 3, could be 6. I mean, from my experience, shoulders take a little bit longer than the neck and the spine because it's a very delicate structure. There's a lot of very, not delicate, I would say complicated, sophisticated. There's a lot of ligaments and tendons, and there's a lot of movable parts in there. So, and we use it all the time to move things around. So they take longer. Like this one I injured, it took me a year to rehab it, 100%. This one I injured 2.5 months ago, and I'm at about 80%. But I still cannot lift heavy weights because it still hurts inside. I mean, I can swim, I can ride my bike, I can do household things, but like 35 pounds kettlebell, I still cannot lift. It still, puts a lot of pressure.
Does your hands do?
No, my hands, I didn't get to that point. Most likely when you fell, there's a clavicle over here.
Yeah.
It's called collarbone, and there's a first rib, and right here you see all these nerves. They come down and they go under the clavicle, which is collarbone, and under the first rib, and they're called brachial plexus. When you fall down on this part moves down and it starts putting pressure.
Okay.
And the ulnar nerve can be affected by that. I'm also going to adjust your elbow on this side, which is also the ulnar nerve, okay? So I'm going to fix this and I'm going to adjust your wrist, okay? So we're going to adjust your entire spine, neck, mid back, low back, and then we're going to adjust your entire shoulder, and I'm going to do some stretches on your shoulder, and hopefully that will do the trick, and we'll see how it goes.
Yeah, hopefully can get rid of my
well, we'll see.
stiffness or...
Let's see how it goes. Any other questions?
No, because I've been doing a lot of research, and I used to be an athletic trainer.
Okay.
And but yeah, I can tell that my range of motion from my left shoulder is pretty.
Yeah, it's pretty limited and painful.
Yeah.
Yeah. So okay, so let's set you up and then go from there. Okay. All right. Okay, so I'm gonna adjust your mid back. Stay down first. Okay. Take a deep breath in. Out. Okay. Breath in. Out. Okay. Breath in. Out. Okay. Have a seat, please. Okay. Lean back on the chair. Oh, that was a good one. Okay. Now let's adjust your pelvis. It's cool. Have you lie down on your side?
On the side?
Yeah.
On my shoulder.
Yeah, on the injured shoulder. Go as easy as you can without hurting yourself a little bit more. Okay, relax. Give me a hand. Okay. You're too much. Just put it down. Okay. So you're gonna have a feeling that you're gonna be falling off the table. So just relax. Okay. Look towards the wall. Do not look at me. Okay. Relax your shoulder. Oh, that was a big one.
Oh boy.
Feels good? No. Get up.
Oh, okay.
Okay. Stand on your feet. Okay. Go ahead and lie on your side facing this way.
Okay.
Okay, relax. Okay, relax. Relax your shoulder.
Oh.
That's a good one. Okay, sit up. Go ahead and take your shirt off.
Okay.
Okay. Back.
Oh.
So what I'm doing right now is basically breaking down the adhesions. Breathe. Smile for the camera.
Oh my gosh.
This is the adhesions that I usually have my massage therapist do it, but she's not here today. So.
Okay. So much pain.
I know. Just breathe deep. Pretend I don't do it. Okay.
Oh my god.
You know how they say, no pain, no gain, right?
Yeah.
Okay. So I'm just kind of like getting a feel, so trying to bring your shoulder back to the reality. Okay. It hurts less on the back, huh?
Yep. And back and front. Actually, yeah, both.
Both hurting.
Yeah, yes. But it seems like you make my nerve tingling kind of.
Yeah, it's okay.
No, it's kind of loosening up.
It's losing out.
Yeah. Ah. 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 Oh my gosh.
Just don't lose consciousness on me, okay?
I will. I promise.
Give me your elbow.
Oh. Okay. Oh.
So now, put it behind your shoulder. Relax. Okay. Now, it's gonna.
Ah.
You wouldn't do it to yourself, huh? You might feel sore tomorrow, okay? Okay,
Extreme pain.
okay. Take a deep breath in. Push against my shoulder, up, up. Push your shoulder. No, no, not the head, shoulder.
Oh,
Okay,
okay.
relax. Take a deep breath in. Push up. 1, 2, 3, 4, 5. Relax. Okay, one more time. 1, 2, 3, relax. Relax, 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 relax. Take a deep breath in. Up. Relax. Relax. Okay, one more time. Relax. Okay, let's do it here. Breath in. Push up. Relax. Okay, breath in. Relax. Okay, breath in. Relax. Give me a second, I'll be right back. Okay. You okay? Okay, now try to move, see how it feels.
Pretty sore.
Okay.
Oh,
Okay,
better.
do both arm, put your shirt on so we can kind of compare. I noticed there's already greater range of motion.
Yeah. Actually, I can feel it.
You can feel it?
Yeah.
Okay, I'll just.
Just a tingling parts of my fingertips.
It's gone?
No, it's still there.
Okay. Okay, so move it side. Wow, that's a big difference.
Yeah.
Okay, now move it. Okay.
Oh yeah.
Now try to rotate.
Okay.
That's a big difference.
Absolutely.
Wow.
Yeah, I can definitely see myself.
You see the big difference?
Absolutely. Because last time when I showed you, it was like right
Yeah,
there.
it was like, I don't know, it was like 90 degrees and 180. It was a big difference. That's pretty cool.
Yeah.
It's gonna get better in a couple of hours. Just make sure when you get home, get some hot baths with Epsom salt.
Okay.
Get some adhesions, and then definitely come back on Monday.
Okay.
I would say let's start with 3 sessions and see where you're at.
Okay.
And then, we'll figure it out afterwards whether you need more than 3 or not. And then on Monday we'll definitely know for sure, because right now your body's still kind of adapting and trying to figure out what just happened. So once it's assessing and figure out what happened to you, then tomorrow you will definitely be sore. So if you drink plenty of water and do Epsom salt with a hot bath to reduce the soreness. But you definitely by Sunday you should feel improvement, and by Monday you will know the percentage of improvement right away. But I can already see that there's a big difference with what it was before you booked in. Cool?
Cool. Thank you very much.
You're welcome.